Welcome back to Sleep Better TV. I'm Scott Drake. Today my guest, I would like to welcome Dr. Harvey Reiter, who practices dentistry in Las Cruces, New Mexico, and we will be discussing the problems with sleep breathing disorders. Dr. Reiter, welcome. Let's talk about sleep apnea. What is it?
You know, if you're a heavy snorer, you're bothering your bed partner, that is dangerous to your health. It's been shown that it could cause problems with the circulation going to the brain, which could lead to strokes, and probably a very high percentage of heavy snorers also have some degree of sleep apnea, which is a very dangerous condition.
And untreated sleep apnea can lead to some dangerous problems. What are the symptoms and what are some of the negative health effects?
Well, the common symptoms are loud snoring, and also there'll be like a time where the person actually stops breathing, and all of a sudden there'll be like a snort. So the bed partner will hear this loud snorting sound, and they'll notice that the person has stopped breathing. This will happen many times during the night, depending on what degree of sleep apnea the person has. And as far as the health problems associated with it, a big one is cardiovascular disease, heart attacks, strokes. Also, it's been linked to type 2 diabetes, erectile dysfunction. Now there's even some evidence coming out relating it to Alzheimer's. Those are the big ones, but there's some other ones. I just can't think of all of them off the top of my head, but those are some of the main ones.
And finally, I guess it's a common conception that certain kinds of people are more susceptible to having sleep apnea. Most people associate being overweight with that problem, but that's not always the case.
It's not always the case, but it's very common. Overweight in neck size. And the way the statistics roll out are that usually men, if they have a neck size of 17 inches or over, and women of 15 inches or over, that's a big, say, risk factor for sleep apnea. And when you see this, it makes you suspicious. And usually if the that person has that size of a neck, they're usually generally overweight. So weight is a big one. But there are thinner people that have sleep apnea.
Doctor, thank you again. My guest, Dr. Harvey Reiter in Las Cruces, New Mexico. You're watching Sleep Better TV. I'm Scott Drake.